Thank you, Chairman Sanders, Ranking Member Dr. Cassidy, and Senator Murray, and members of the committee. Thank you so much for the opportunity to speak to you today. As a board-certified OBGYN hospitalist who manages both high and low-risk pregnancies and has delivered thousands of babies, I really do have the best job in the world. Not only do I have the distinct honor and privilege to be with women and their families during the most exciting, challenging, and sometimes heartbreaking times of their lives, not only do I get to help usher little lives into the outside world for the first time, but I also serve as an advocate for both my maternal and fetal patients. One of the reasons those of us at this table likely chose the specialty of obstetrics was because of the challenge of taking care of two patients at once. Induced abortion, which intentionally ends the life of one of those patients, is not healthcare. It is not performed by the vast majority of OBGYNs, and it actively harms our patients. Thankfully, in most circumstances, the lives of our two patients benefit one another, and our mantra of healthy mom, healthy baby is a reality. There are, however, still situations in which a pregnancy complication can endanger the mother's life. While these most often occur after the point of fetal viability, currently approximately 22 weeks of pregnancy, they can occur before this point. The decision to intervene in these situations is extremely difficult and not one that any of us take lightly. I have sat on the edge of my patient's bed crying with her as we discussed why we couldn't wait even 1 or 2 more weeks when her baby might survive to deliver her. In these discussions, we recognize that our intent in intervening is to save the mother's life with the unintended consequence of our fetal patient losing his or her life. An induced abortion occurs when the goal is to end our fetal patient's life. In my nearly 2 decades of practice, I have never performed an induced abortion and have also seen most of my colleagues provide excellent care to women, even in difficult circumstances, without abortion as well. There's been a lot of false information being spread that laws limiting abortion will prevent these life-saving treatments. But honestly, this is absurd. Not only do no state laws prohibit these treatments, but even state laws restricting abortion before Roe allowed for them. The more than 7,000 members of AAPLOG, along with the remainder of the 93% of OBGYNs who do not perform abortions, know that induced abortion does not need to be legal in order to ensure we can provide our patients with excellent health care. Women deserve fully informed consent and ongoing medical care. This is yet another point of agreement we should have at this table. However, the same abortion advocates who are positing that women will die from ectopic pregnancies if states restrict abortion are the people who have, for the last several years, been advocating for women to receive abortion drugs without first being seen by a physician, which is critical to ensure they do not have an ectopic pregnancy, which occur in 1 in 50 pregnancies and are the leading cause of maternal mortality in the first trimester. This is not good medical care, and women seeking abortions deserve the same level of health care as any other woman. Induced abortion has no health benefits to our patients. It ends the life of one and often causes significant harm to the other. For example, there are more than 160 studies that show an increased risk of preterm birth in future pregnancies after surgical abortions. Having sat with a patient during the loss of her 5th child due to extreme prematurity after having surgical abortions with her first 2 pregnancies, I can tell you that this is devastating for women and their families. Abortion also leads to a significant increased risk of adverse mental health outcomes. The vast majority of the literature on this issue shows long-lasting mental health effects from abortion, including depression, anxiety, drug abuse, and suicide for at least 20 to 30% of women. When our country is already facing a mental health crisis, we should be minimizing things that contribute to, not encouraging them. As OBGYNs, we love caring for both our patients. We all desire for women to have the best possible health care and for them and their children to have the best chance to pursue their goals and dreams. Pro-life laws have not created a women's healthcare nightmare. The idea that induced abortion is the only way women can be successful or healthy has. We now have the opportunity to change course, and I invite my colleagues at the table, the thousands of OBGYNs across this country, and you, senators, to lead the way as we empower women with accurate information, exceptional healthcare, and better solutions for our maternal patients than ending the lives of their own children.